to make sure.
Hello and welcome into this week's edition of AFMC TV. We're so glad you're joining us. Today we are kicking off talking about some best practices when it comes to picking out a hearing aid. And joining us now is Dr. Mary Chatelain at Pinnacle Hearing. Hi, Dr. Mary. How are you?
Good. Good morning. How are you doing?
Good morning. I am well, thank you. So, wow, we have just come through the holiday season. We've spent time with our families. We maybe have noticed that members of our family aren't hearing quite as well as they have in previous years. So what maybe would be the first step in identifying if someone needs a hearing aid?
Well, I think that, the holiday season definitely brings more people into our clinic, and not necessarily the people bringing themselves, but their family members bringing them. Their family members being around them and really noticing, hey, that you're not hearing like you should, you're responding inappropriately, and those family members really encouraging the patient to come in. And sometimes it's so much as actually bringing the patient in, not just telling them, hey mom, you need an appointment, but saying, hey, I'm going to get my hearing checked, mom, why don't you come with me and get yours checked out? But definitely the first step is really just acknowledging to that loved one, I think something's going on, let's get you scheduled for a hearing evaluation.
So let's talk a little about the process of going through having a hearing evaluation, kind of what that entails, and what is it that you're looking for as an audiologist?
Okay, awesome. Well, the first step, of course, is going to be a thorough case history. Any doctor you go to, you answer so many questions, but really understanding the background, your background history. Is there been a lot of noise exposure? Is there hearing loss in your family? Really helping us understand where you come from and what struggles you're having. Then getting you into the soundproof booth. Everybody kind of gets scared when they see the big thing that looks like a refrigerator, but a basic hearing evaluation in a sound treated environment. So in that situation, we are going to do what people commonly think of, okay, I'm going to hear the beep and I'm just going to raise my hand every time I press a button. So that's part of it, but we definitely take it a step further where we do speech understanding scores. So getting that patient in a comfortable situation where they aren't lip reading, we're going to say words to them, but they can't see our face. So we learn so much from patients. Patients will come in and say, it's not that I can't hear, I hear, it's just everybody mumbles. Well, whenever we can recreate this in the booth setting, patients do find, hey, I am lip reading a lot more. I didn't know that I really need to see someone's face. And so doing this speech evaluation and then us doing bone conduction scores so we can determine, okay, what type of hearing loss do you have? Is this something that sits or neural? Is this due to just the normal aging process and genetics? Or is this something that is a sudden hearing loss? Is there something foreign in the ear canal? Does this really require a medical referral? So before we look at hearing aids, we really want to understand, okay, what is the background with this patient and what type of hearing loss they have? Because it could be that, all right, we need to refer you to a surgeon, we need to refer you to another team, medical team, and it not be hearing aids or the fix. So you definitely want to have a thorough evaluation going in.
So after that evaluation is completed and all signs point to, yes, this is part of the aging process, this individual is a candidate for hearing aids, then what are those conversations like? Take me through those steps.
Well, so once we rule out any FDA red flags that they would need to be referred out, typically in the same appointment, you can have a thorough hearing aid consultation. So we'll go over the results of your hearing evaluation, talk about your speech understanding, and then get a plan together where, okay, do we recommend hearing aids? So if we do, we are going to talk about the style. There are so many styles of hearing aids. There are kinds that go in your ear. There are kinds that go over your ear. So we're going to start there. We're also going to talk about the different features of the hearing aids. Do we want Bluetooth? Do we want them to be rechargeable? You know, there's a lot of lifestyle considerations that we need to think about. Each patient is different. What they're exposed to daily and what their communication needs are different. So we're going to take a thorough inventory of that. We're also going to talk about technology. Hearing aids are basically like computers. You know, if you go into the Apple store to buy a computer, they're all basically going to look the same, but it's going to be the components inside of the computer. You know, how are you going to use that computer as to what level of technology you need? So it's the same thing with hearing aids. A patient who is you know, let's say that they are still working, they're in a lot of different meetings and traveling, their technology need is going to be different than someone who is home all day, maybe getting out once or twice a week. So not only are we looking at their hearing loss, but we're also looking at what their communication needs are. So it's basically a conversation that you are going to have with your provider. So whenever you're getting hearing aids, it's important to realize it's not just a product you're getting. It's not just a computer. You're also going to be purchasing services. So the fitting process, the follow-up process, all that's going to be included whenever you're purchasing a hearing aid. So we definitely are going to take time learning about you, what your needs are, and also if you would be a good fit with our practice, because it's not just going to be one visit. There are going to be follow-ups. That's how you're successful with a hearing aid, is going to be the hearing aid, but also the person fitting it and the follow-up process. So during that, we call it really a hearing aid evaluation. That's whenever you're going to have the full hearing evaluation, and then also the consultation, where at the end of that appointment, you should have a clear understanding what hearing aid is recommended for you. And, you know, typically you're not going to be thrown a crazy amount of options. Typically there's, you know, 1 to 2 options of what hearing aid is going to be the best.
And that was going to be my next question. Are you trying on hearing aids like how you might try on glasses? I mean, there's a wide variety, but it doesn't sound like that's the case.
Yeah, well, it really depends on your hearing loss and your needs. There are times we can do a live demonstration in the office if your hearing loss can, if we can fit you with the type of demonstration hearing aids we have in the office. Doesn't always work for all of our patients, but I would say about 75% of our patients that works for. But it is going to be a little different than glasses. You know, whenever you're trying on glasses, typically you're just looking at the frames, kind of how it looks. It's not really what it looks like through the lens. And so that's going to be a little bit different. But the chip inside of the hearing aid, we can put that on any style. So if your hearing loss is where we can do a demonstration in the office, the ability of what you are going to hear is going to be accurate. The style and the look of it might be a little bit different. But it is important to note that with hearing aids in the state of Arkansas, there is a 30-day trial period. So let's say that for some reason you're not able to try hearing aids on in the office and you're scheduled for a fitting. And so that fitting is going to be the first time that you wear those hearing aids. You do have a 30-day trial period. So you are able to go home, wear those hearing aids around your family in your real world environment. You will have some follow-ups during that first 30 days, but it is a way to determine, hey, does this work for me? It's not going to be something where you purchase and then if it doesn't work, you just put it in the drawer. Your audiologist and hearing care professional will work with you during those 30 days.
That's great information. I certainly had no idea. You kind of have, as you said, 30 days to love it or leave it and find something else that does work.
Yeah, and you know, when we're looking at hearing aids, we're looking at the technology. Then when you come into the office for the hearing aid fitting, that is going to be the process of you actually getting the hearing aid that is ordered specifically for your needs. So you'll have a serial number attached to that hearing aid, and during the hearing aid fitting process, that's whenever we go thoroughly. We're going to program the hearing aid to your hearing loss. we are going to run verification measures. So we're going to make sure that that hearing aid that we've programmed for your specific hearing loss, that when it's in your ear, it's amplifying appropriately. And so verification is going to be key to a successful hearing aid fitting. During that fitting process, we're also going to go over insertion and removal. So how to put the hearing aid in your ear, how to take it out, how to, if it has batteries, how to open the battery door and change that, or if it's rechargeable, how you put that on the charger every night.
Well, Dr. Chatelain, that is some very valuable information. And we appreciate you joining us today.
Awesome. Well, thank you so much for having me.
Thank you. Rebecca Denniston joins us now, and we are talking about anti-aging. Hi, Becca. How are you?
Hi, I'm doing good. How are you?
Doing well, thank you. So we're all in this hot pursuit for the fountain of youth. How do we look younger? What this time of year, cosmetically, what are some of the things that are being done to our skin?
Yes, so that's a great question. There's a lot of things that can be done. I think it's very tailored to the individual. This time of year, some people choose to do, aggressive in-office treatments like lasers and peels and resurfacing things, and then others kind of choose to do more at-home care. So there's a wide array of things that can be done. But I do think this time of year, we really see a step up in those in office procedures like aggressive or ablative lasers that are resurfacing your skin, chemical peels, other procedures like microneedling that kind of resurface the skin. So there's a huge array.
Let's talk about microneedling. That's not something I'm familiar with. It
Yes.
sounds prickly.
Yes, it is. So that's actually been around for a while now, but I think kind of Arkansas has been on the slower end as far as picking that procedure up. But it's actually a pin device that's used to create microneedlized holes in the skin. And when you do that, you stimulate your own body's wound healing processes, and then that in turn stimulates collagen growth. So, by doing so, you stimulate collagen, you increase your cell turnover, and you kind of resurface the skin and boost your collagen, which everyone wants. So, it's a great procedure with minimal downtime.
What are some of the other anti-aging procedures that folks might be looking at doing? I mean, and I'm kind of thinking well beyond just a facial.
Yes. Yes. So, really, kind of the way I like to think about it is least to most aggressive treatment. So, there's your over the counter skincare, prescription skincare products, and then you get into more of light chemical peels, medium chemical peels, all the way into the lasers and the microneedling and things like that. So I think, for beginners that really haven't done much, I think starting, with at-home products that you may get over the counter is an easy thing to do. Basic things like investing in good sunscreen, maybe over-the-counter retinol or vitamin C serum. Those are kind of the early basics that you can do.
The retinol is that, and even the vitamin C. Can any age demographic be using those? Or is there something specific if you're in your 20s and you're doing over the counter? Hey, look for this product. If you're in your 30s, look for
Yeah,
this product. If you're in your 40s, look for
yeah,
anti-wrinkle or whatever.
yeah.
If we're just running down to the local drugstore to kind of help get something to help hydrate our face and
Sure.
make us look brighter.
Sure, that's a great question. So, I think for anyone, of course, we recommend a sunscreen, but then anyone can actually use a retinol. So, we use retinols all the time in kids with acne, but then that goes into your young adult and later adulthood where you're trying to really get those anti aging benefits. So, retinols are basically a step below a prescription retin A. And they work by increasing your cell turnover to where you basically are making new skin cells by using this topical cream. So anybody can use a retinol. Over the counter retinols are definitely safe. They've been around for a long time. So that's for sure something anyone can do. As you get older, though, like let's say 40s on up, 50s, 60s, 70s. One of the big things that we're seeing now more than ever is hyaluronic acid. So you're going to see that in a lot of over-the-counter products now, and it'll usually say HA or sometimes hyaluronic acid. And that works to kind of draw water into the skin. It makes you more hydrated, helps with fine lines and wrinkles, and sort of plumps the skin. So that's sort of something that a lot of people are wanting to do as they get older.
Definitely. And we don't need to just think about our face, we need to think about our necks too, right?
Exactly. I tell everybody to treat your face, your neck, and your chest, if you can, the exact same way, because it's really something that you want to kind of travel down. So
What you are using on your face, if you're doing an over the counter, can transfer even down onto your chest.
that's correct.
Okay.
Yes. By all means, you definitely can. I think one of the big misconceptions I hear a lot about retinols or prescription strength retin-A's is that they're going to dry you out. So I almost hear that every day in practice. People are afraid to use them because they think they're going to get red and peely and irritated. And really, if you use them the correct way, by starting out maybe 2 or 3 nights a week and using it with a moisturizer and kind of building yourself up, uh, you shouldn't have dryness or irritation. So really, anybody, if you have more sensitive skin or not sensitive skin, could use those products.
How do we know what product is best for us?
That's a good question. I think so. That's a hard thing to answer. A lot
Yeah.
of times we have to, maybe see you as a patient or something to really kind of tailor things to you. But anyone can get away with using a good sunscreen, a good moisturizer. I think one of the key things is sticking with gentle skincare. So brands like over-the-counter brands, CeraVe, Cetaphil, those are really gentle. They're going to be okay for just about anybody. And the same thing with sunscreen. And then when you get into those more aggressive, things that you want to do, maybe a retin-A or something like that, we definitely would want to see you in clinic to decide if that's something that's right for you.
And there are benefits with some of these procedures,
Yeah,
not just for vanity.
right.
And I'm thinking like with microdermabrasion,
Mhm.
something as simple as that, just clearing out those dead skin cells, just so that your makeup lays better on your
Yeah.
face.
I think we're seeing more and more things that, infomercials and different things that you can do for, at home treatments and things like that. I think sticking with the basics is an easy thing that any person can do that's going to take them a long way. Just like you said, there's a lot of benefits with retinols and retin-A's. They're going to really help with fine lines and wrinkles over time. They're going to reverse signs of sun damage and aging, which we all need. And then there's also the patient that may need it for, acne or scarring or pigmentation, things like that. But yeah, I think you're exactly right.
Let me ask one more final question. Humidifiers. Are we wanting to keep some moisture in the air to help with our skin and not be so help
Yes.
not be so dry?
Yeah, yes. I think that's very important, especially this time of year. So many people are dry, especially if you're using those products like we were just talking about, the retinols, the retin-A's. Humidifiers are an easy step to add moisture back into the air and your skin and definitely have a lot of benefit.
And it doesn't hurt to drink water too, to help
Yes,
keep your
that's
skin
right.
hydrated.
Yes, definitely.
This is the hard time of year to drink cold water.
Yes,
Summertime, it's easy.
yes, exactly. Yes.
All right. Becca, thank you so much for joining us
Yeah.
today.
Yes, thanks for having me.
And thank you for joining us. We'll see you back here next week for more AFMC TV.